All. This is Dr. Mobeen Sayed from Drbeen.com. Welcome to another show for today. Today is April 5. Thank you very much for your time and joining us. Let's have a quick discussion. So the first thing, one of my family members got vaccinated today. I have been actually trying so hard. It is so funny. I've been trying so hard. So I am the one who actually became eligible because of my age. So I have been trying so hard to get a slot and I'm not getting it. Or I'm getting slots like 10th of April or 15th or May 10. And I've been throwing tantrums and saying, why not today or why not tomorrow? Anyways, one of my family members just went on the same app as well, and they got themselves the vaccine scheduled, even when their age is actually not where the eligibility is. They're near that age. So got the vaccine, Johnson and Johnson. So here is the experience. Of course, I went with them. So when we went over there, we did not know what vaccine will be given. So when we went there, they said, well, we're giving Johnson and Johnson today. I'm a little apprehensive of Johnson & Johnson because of adenovirus. But anyways, so we asked them that, hey, any other? They said, no, this is what we have. We said, can we ask you about the side effects and those things? They said, you can ask the nurse when you go in. So we stood there in line, went in. Nurse had asked that, hey, so my family members, we have allergies, but not higher. You see me congested as well here and there. So I had suggested some of the, I don't want to say it here because I don't want folks to follow that, but I had given her some medicines before. So the nurse said, did you take anything? We said, these are the medicines. And they said, oh, wow, that is going to cause immunosuppression. And I did not argue because that was not a place to start arguing. So then we said, so that means we should not get the vaccine. And they said, no, you should get the vaccine. So we got the vaccine, sat down there for 15, 20 minutes of observation. And then during that time, one young girl in the back, so all of a sudden the alarm started going off. So it turned out one of the young girls in the back who were just vaccinated, she fainted. And now they were taking the defibrillator out and they were trying to, take care of her. Interestingly for me, or annoyingly, they actually did not have any readiness of that kind to say, here is a literature, a stretcher, and put the patient on this, and here is a doctor at hand, or here's an ambulance at hand. One of the paramedics over there was holding her legs up to keep the pressure or flow or volume back in her body. That was just weirdest thing. She was sitting up, she was passed out, and one of the person had her legs held up. This is how they were helping her. No stretcher, nothing. So then our time expired. We came out, and then the fire truck came in as well. And so I do not know if they had to move her to a hospital or I looked at her in my glance. She did not look allergic. She just looked like she had passed out, but no other signs I could observe of allergies. So hopefully she's fine, but I didn't think that they were ready, that if somebody, other than I think they may have EpiPen or defibrillator, and that's it. So that was the experience there. Since then, the family member, they have arm pain, slight arm pain. With that, the tip of the tongue became numb after some time, and a feeling of stuck gulp in the throat. And that is it so far. And we would continue to observe and we'll see what happens. Hopefully everything will be fine. I am also trying to get myself on the slot as well. So hopefully I'll get it soon. Okay, so let's see the questions. Yes, Doug, frog in throat. And so I was just talking with her a few minutes ago, and she was saying, I'm just so annoyed it is not going away. And she was getting angry. And they told her that, hey, you may be very tired, you may have fatigue, you may develop fever, chills, but it would only last for a couple of days. We said, what if something severe happens? They said, well, just call your doctor. So we said, is there no no place to go and talk? And they said, no, just call your doctor. So that was the readiness. Patricia Hawk says, Dr. Bean, in California, you should have been able to look for the brand of vaccine you wanted. I have relatives who have waited for Pfizer. That's what we thought. So I asked her, I said, do you want to go back and just wait for Pfizer? And she said, no, we are here. Let me get the vaccine. I think she just wanted to get it over with. So done. Now it is my turn, and the slots that I'm getting are like 2 hours away from my place, and I don't want to go get the vaccine and then drive 2 hours back, or have someone drive me while maybe on the way I become a little more then serious. Then what? So I want to have something nearby. But anyways, that was the experience. um, all right, so let's see if you have any questions, please. So Margaret says, Dr. Bean, please don't yet. Okay. But I'm Margaret, I'm not even able to get the slot. Mark O'Kane says, fortunately, the AstraZeneca hasn't killed me yet. Closet Picker said, you didn't go help the lady in distress. Closet Picker, it is actually these places, it is not right to try to. What they were doing was right, but um, the readiness looked really bad. Hard work, Patricia. Dr. Bean said no, he's hoping to get. I am work daily. Even now, before this lecture, I was trying to get myself a slot. Somehow, my wife was making fun of me that when it comes to me, my app just continues to tell me that we have a lot of load. And she said I could just get it. So this seems to be a conspiracy as well. Nancy, thank you very much. I think that I am fine with Moderna, Pfizer, or Johnson and Johnson. It's just that I want to get it. Johnson and Johnson, I like it from one point of view that it is just one dose. What scares me is the adenovirus-based behavior, and that could cause clotting type issues. But other than that, it should be fine. Jenna says, my aunt for allergic reactions, Benadryl didn't work. Sorry about that. So Denise, I had already prepared her with the right medicines and given her the right medicines. So when that nurse said, oh, you took those medicines, that would cause immunosuppression. So I was now standing behind. I didn't want to argue about it. And I was thinking my wife must be thinking that that he's given me things that are immunosuppressive. But on the way back, when she started developing some of these things, she was saying, oh, I am so happy that I had these medicines, because her tongue almost became numb up to half of it. And she started having burning sensation, which is paresthesias. So she started having paresthesias. Jenna, no. So actually, I was going to say that if you are okay, you all are okay, I would shut down the discussion a little earlier just to be with her. It's not that I can change anything. She has to go through this process now, but just being around. Janet says, please type in Q's before your question. Yes, if somebody has a question, please type Q, because I can't filter out sometimes very easily where the questions are. Sayed Anis says, hello, sir. Dr. Anis from Pakistan. Kindly give your expert opinion on Chinese Sinopharm vaccine administered here in Pakistan. So, look, I have talked about the Sinopharm's um, data, which was published by the company, just like now I talked about Pfizer BioNTech data, which is published by the company. Their data was great. The thing that disturbed me was that they said no side effects. But then my further experience with that is that I had asked my family members to take this vaccine. I had asked my friends to take this vaccine, and they took it. Five of my friends, they were traveling, and then they saw a vaccine point. They went and got the vaccine. They got into trial. And when they got into trial, all five of them said no side effects. So I thought they may have gotten placebo. But a few days ago, I discussed it that one of those friends who still did not know they were placebo or not, his wife became ill with COVID because she went and met a brother of her who had returned back from UK to visit. Don't know why people are doing this, but anyways, they went and they met her. There was family there. Somebody had COVID. That went to the other people. She came back. She had COVID, and the variants are fast in causing symptoms. And the my friend got the COVID as well. And that night he said, I was restless. I could not sleep well. But the next day was fine. I asked, why don't you get the antibody test? Or he said that, hey, why don't I go get the antibody test? And I said, yes, do it. 400 titer. So, and before that, he had gotten the antibody test and 0 titer. So that is how well the Sinopharm had worked. So this is my limited experience, and the data that I presented looked fine. None of the folks, even my own family members who have gotten it, they didn't have any side effects at all. So don't know yet. This is the limited data I have for you. Ralph says, I would really appreciate your thoughts on Geert Vanden Bosch and his study and coming catastrophe. Thank you. We'll be okay. So Anne is saying, any data yet on children under 15 years of phase 3 trials? That is what I was actually going to present today. And while I was looking at the important topics, this topic came up, and I thought this was more important at this time because just a couple of days ago, news outlets were saying, well, the vaccine efficacy is going to go down in 3 months. So just imagine how worried people get. One, they have to go through the trauma of getting the vaccine. It is a traumatic experience. Then they have to be kind of confused at what is going to happen to me. Then on top of this, the news media keeps saying 3 months later, the vaccine would have no efficacy. And unfortunately, medical professionals, including me, I'm in that professionals group. Medical professionals have become so available to say whatever someone wants them to, that all kinds of medical opinions are available. So the experts who were worried about the 3 months phasing out of the vaccine efficacy, they were some experts as well. Somebody had tweeted at me, they listened to some video of mine, they were a doctor as well, and they tweeted to me saying, not impressed with your opinion. And I looked at their opinion, and I wanted to tell them that the feeling is mutual. Unfortunately, this is the situation with the medical field at this time. So having said that, I thought this was important to understand that vaccine efficacy continues to 6 months. We know it is going to continue to 2 to 3 years, number one. Number two, I thought it was important to understand that the efficacy actually improved. And thirdly, the protection was 100% from severe or deaths. So that was very, very important. And the side effects were not, as people were saying, that people would become zombies or something. That was not happening. Or the escape would occur and then the whole world would get another variant and so on. So the variants were being taken care of by the vaccine as well. So I thought this was more important, although children is very important as well. So I'll talk about that tomorrow. So ivermectin man link. So let me get you the link here. If you go to So I put the ivermectin man link up. Strange thing was that previously I used to be able to tweet it. This time I just did not find how to tweet it. But if you go, and I'll get you the link right now, but if you say Tspring Dr. Bean, you can actually see here. And let me put this link over here. I think it is doing this because I am logged in as well, but still, let me actually log out, and then do this again. So here you can actually go and see the store like this. Here, I'm going to share this link here. So this is the Tspring link. And here, if you see, I was kind of cracking up because the ivermectin man makes me crack up, actually. Absolutely, Doug. So it makes me crack up. So if you see here, there are these, this is, I think, joggers, then the mug, a bigger mug or something, leggings, and then mask, t-shirts, hoodies, stickers. So if you need anything else, just tell me that, hey, I need this, and I can go in and add that as an item as well. It would appear on YouTube about a week later because YouTube has to review these products before they let it on. But if you go to this link, you can buy now. And please tell me if you needed something else, for example, tote bag or something, some other kind of hoodie or sweater or t-shirt or socks. These are all are possible. But the ivermectin man is funny, actually. Steve, that is interesting. CDC just yelled at Walgreens for trying to do 28-day gaps with Pfizer instead of 21. They're trying to go after UK model, huh? Delilah says underwear. Can you hide some ivermectin in the clothes? Maybe. Undies? Stop. So many people for undies, huh? Okay. Nancy says ivermectin clothing is the bomb. Ivermectin, it makes me laugh so much whenever I look at it. Paul Burke says, looks like I'll be shopping online in the near future. The shopping is in your future. Janet says, Susan, thank you. I know Dr. Laurie was very careful and very conservative. No cherry picking of data. Yes. Jenna is saying going. So Jenna, let me know if there is something that I know that you were saying that you needed something with a zip. So I have here this one hoodie, but I did not know if it is t-shirt time or hoodie. But this hoodie here has a zip in front as well. But if you were looking for something else, just tell me. And I can just go to the Tspring and say add apparel, and they say what do you want, and then you say add this as well, colors and other things too. This color had a funny thing. Can you notice? I was cracking up. The color, the pure black, you could not see ivermectin man's feet, so he seemed like he didn't have feet. So I changed the color to slightly lesser than pure black. Interestingly, I did not have white there. So they had three colors only available, grayish, brownish, and this. But I can go check more colors there as well. It was interesting. Anyways. So L says, still hoodie time in North Oregon. Okay, got it. On the back of the shirt, I wrote the ivermectin. What was that? The COVID crusher. Many folks had actually given me very good ideas, and I could not find those I could not find those back of the shirt messages. So maybe send me those messages again, and I can create some shirts with those messages. Thank you very much, Super Steve. I have those as mugs and T-shirts as well. I actually am not so happy with the mugs quality. The printout looks so faded, and so we'll see how does this come out. So, not just another mother question. Please advise how the vax stimulates immunity, as my son has PANS, basal ganglia autoimmune encephalitis. So, here is the important thing. It is not known that the vaccine must attack or cause side effects in those who may have other autoimmune diseases. In fact, they had been using this stratum of people who had either autoimmune diseases as a subset of a population that must be vaccinated and protected against the actual infection. So they had come back and they said this was fine. Now, the question, if you ask me, again, this is not an advice for your son. I cannot offer a specific advice. I usually talk in theory or concepts, or I talk in my terms of my own patient or myself. I can't give an advice for a specific patient. But for your second question, your first part of the question, how does the vaccine stimulate the immune system? When the vaccine is given, the innate arm and the adaptive arm both will work. Innate arm will be stimulated right away. That would create some cytokines, inflammatory proteins. If somebody has autoimmune diseases and their cells are already a little bit tipped towards reacting, then they might get some more inflammatory messages to say, okay, get reaction. But they have not seen those reactions to be severe. On the other hand, those who have severe allergies, they have seen them to react severely to allergens in the vaccine, not to the vaccine itself, but to allergens in the vaccine. So, from the data point of view, they say that it is fine for autoimmune diseases patients. Passing Time in Texas says, Dr. Mubin Sayed, question, update on Novavax safety and availability in US. So I have to do it. So Margaret was talking about that as well. So I'm going to look into that. Texas Meg says, question, what would Bean do? Vast ageism towards the 1% US that has greater than 25% deaths. Blended vax data discounts poor vax response, now infection post-vax in LTC. So Texas Mag, I am hoping that the already vaccinated folks cover this population. And hopefully that is one of the reasons that the cases have gone down. So let's continue to discuss more and see more. You're correct that blended vax data is kind of just blended. We have to actually see the follow-up data for the individual demographies. Lisa says, elephant in the room. What do you think about Dr. Hill's report being questioned for questionable results and being messed with? I have to see this one. Believe me, I have not gone on to look into that. The reason is, as much as I'm upset that WHO came out and they did this thing and they less than professional, less than ethical, bad things are what they did, I still have not given enough time to actually go and see the data because I thought Dr. Corey, Dr. Laurie, and others are working on it. And I would invite them and present that data to you. So then I could continue to look at other things like we just did. So I was actually thinking today to request Dr. Corey to come talk about WHO's data once more. So if you like, I can personally go and look at that data as well. If it is not redundant, then I should do it. If it is redundant that Dr. Laurie, Dr. Corey are covering those things, then I can continue to talk about other things. You tell me. COVID-19 says, when will we go to pre-COVID normal life? Question. COVID-19, when you change your name to normal life. So I think that in another couple of months, we'll be back to normal. At least that is what I believe would happen here in US. In others, many of the other countries, for example, UK is almost, from the case point of view, UK, Israel are doing very good. And I think they can now start trending towards, inching towards, can we go back to normal? I think what they'll have to do is, their own community is safe now. How do they figure out that interaction from not vaccinated or not known to be infected or protected yet? How do they work with that? So some quarantining for the travelers, or some travel restrictions, or limitations, something will have to be done. But I think they are about to get back to normal. Israel is about to get back to normal. Many other countries, I think South Korea is almost, other than mask, they're back to normal. I think US will be back to normal in a couple of months as well. Bangani Shongui says, why don't we remove COVID virus ability to multiply and use it to trigger an immune response? That's exactly the, very good. So you're a great scientist. That is what an inactivated virus is. And so, for example, Sinopharm is that. Um, India's own vaccine is also an inactivated virus. So yes, what they can do is they can put some chemicals on the virus that would lock its messenger, its RNA. And so its RNA, this is like removing the brain from somebody. And now the rest of the body can be given to our immune system to say, okay, look at it and develop your immunity. So yes, inactivated virus is that virus. And there are vaccines with that. Muhammad Minhaj says, which vaccine is best for people who have like hypersensitivity reactions? I cannot say this. Uh, this would have to be individually looked at. Franz Lorraine says, 70 likes, get pawing, you lazy beans. Yes, paw, paw, and like more. Um, Denazir Etizol says, doctor, for people who have more than 1 month since they received the first dose of AstraZeneca, they should be concerned about thrombosis? No. And should use anticoagulants? No. If so, think about it. The reason, and this is why I feel that uh, this continuous effort to suppress the mechanism, to say this has nothing to do with AstraZeneca, just stop talking about it. One bad outcome of that is that people do not know why it happens. Second bad outcome of that is that if this happens, doctors do not know what to do because they're just not getting ready, because the vaccine company says it's not us. The basic problem, let me give this disclaimer: if this is because of the vaccine, then this is how it would happen. And that would be, if it is because of the vaccine, just like in heparin induced therapy, it is the antibodies that are doing it. That means vaccine or not, anything. Let's say my hand is an antigen, and that is going to trigger the antibodies. We know with SARS-CoV-2 as well that antibodies do not get triggered right away. They take 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14 days or more. So anywhere from 5 days to 14, 20, even 30 days. So if any vaccine will cause immune system response, that may be the vaccine's own response, or that may be extra antibodies that will be formed. They will be formed anywhere after 3, 4, 5 days. So 5 days to 17 days is the window during which this can happen. And if it did not happen during that time, then the person's immune system did not bother. And it will not, in theory, it will not be bothered again with that. So Bambi says, Dr. Bean, medical lectures, 12th April, non-essential shops open and beer gardens and pubs open. Here, saloons open. 17th May, indoor dinings open if the data permits. Excellent. So I think the thing that I love it. I wish US could do this as well. Although we have opened many of our states as well without caring for where the results are. And some of them have good results as well. But generally, US is not doing good. I like it. I think the thing that UK will have to keep in mind is to not mess it up again. If it is because of vaccination, then they will not mess it up. If it is because of vaccination plus the social distancing plus lockdowns, then I think we would find out when the 12th April's opening occurs to see what kind of trend we'll see. I think we'll be fine. Ray says, please put Luffy on the t-shirts. And Ray, we actually have Luffy on the t-shirts. Let me show you. So if you go here and go to April's, you can actually see. Do you see this? I laugh at these things. People have started asking me not to giggle. So Luffy knows the prophylaxis. So here is Luffy. Look at this. So we have Luffy there as well. Ninja Blue says, I don't know what you mean. The US is not doing well. In New Jersey, one of the top ranked COVID states, hey, there are no lockdowns. Ninja Blue, what I mean by that is that for the given population, 300 million, we are not doing as good as many other with similar populations or greater populations are doing, and we could do better. That doesn't mean we are not doing in some areas better. That simply means as a country, we are not doing better. If you think that after 500,000 deaths, we are doing better, then we need to figure this out and discuss it more. Lisa says, giggle schmiggle, who cares what they say? It's your time, you're donating. Absolutely, thank you. Westfield says, a new Bollywood celebrity gets COVID each day, but not one has died. So I think that narrative is strong with the public that only older sick people die and the rest just get a 2-week break and back. Or even in the US, if you see, when Trump became sick, he was out within 2 days. I think that he got a very good support from medical side. Similarly, when Giuliani became sick, he was out as well, and they were both from an age point of view at risk. So there is a difference in management. I think for us commoners, if ivermectin was approved, we will be fine as well. So Doug Gross says, how is Egypt doing? So let's see. So Worldometer Egypt. So they are still third wave or just 2.5 wave. Active cases are going upwards. Deaths are kind of consistent. So I would not call it doing great. If we have to see doing great, I think, so look, US is doing great too in some ways. Here is how US is doing great. Look at the number of cases. We went from here to this horrible state. And from there, we are back here. So I think from this point of view, we are doing great. But 40,000, 50,000 daily cases, that is a lot. And if you see here, our active cases still 6.8 million people infected. Don't tell me that this is because we test more. Look at the number of deaths. that are also. So this is what I would love. If this continues to go down like Israel, as it is going down here, then we'll be better. So let's see UK. Look at this. They can still go down further, but very, very good. Look at this. Active cases going down 322, a lot of cases, but still look at the deaths. So from deaths point of view, if you see the US's map is downwards, if you see UK is downward, which is the good thing. Israel. Look at this. This is, they somehow have become static at this level. I would have wished that this goes away as well. But the active cases really down 5,000. And number of deaths are, the number of deaths do not seem to be, maybe it's just that the number is lower, so they don't seem to be down the way we saw with others. But very good result with Israel. Somebody had said, yes, Paul, France is the best. 108 likes, get point. Yes. Herd munitions plus vaccine. Yes, herd immunity plus vaccine combined are working. Yes. So Sepasti say, have you read about these meds that bind to the main protein structure of SARS-CoV-2? Calatin and pelitinib clearly showed that highest antiviral with good cell compatibility. Thoughts? I have not read them. Let me put them here for me to read up. So these are calpeptin and pelitinib. All right, I'll look it up. Simple Steve. Don't want to talk without seeing it. Emily says, my functional med doc wants me to remain on ivermectin until my second vaccine. Does this sound reasonable? I think it is fine. What he's saying is that, hey, from first dose to the second dose, there may be some chance of catching COVID, so please stay on prophylaxis. I keep my patients on this. Chuck Becker says Mr. Gross always gets top billing. J. Raymond says, I am scheduled for my second Pfizer shot on April 10th. April 10th. But it is only 17 days. Hospital says it's okay. Should I reschedule? I am an essential worker. Yes. Yes. So I don't know why did they schedule you so early with Pfizer. Take so 3 weeks. I think 4 weeks has been the right one. What I do not remember off the top of my head, Jay Raymond, is Pfizer's trial data and the doses after. That's the piece that I do not remember. So if their trial data said 3 weeks later, then that would be about 21 days. I haven't seen anything lesser than that. So I don't know why did they do 17 days. Pfizer, Mary saying Pfizer 21 days. Yeah, that's what I recalled, that the minimum was 21 days. So I would actually go beyond 21 days, not before. Mr. J says, how will we know if the variants attached to more than ACE2 and T cells? Could it gain access another way? So if this happens, that will not be a variant, that will be a new strain. For example, SARS-CoV-1 works, I believe, with DPP4. On the other hand, SARS-CoV-2 works with ACE2. So imagine if something else came in and that worked with insulin receptor. I'm just making up something. Then that would be SARS-CoV-3. CDC gives conflicting info. Some days, some says 21, some says we can be 4 days earlier. I think it is interesting to say 4 days earlier, but let's work with the trial data results. The reason I'm saying this is that we saw from UK that they said that, hey, if you had given the vaccine earlier, then the efficacy was lower, and if you delayed it, the efficacy was higher. And they are trying to figure out what was the reason. Was the early vaccination, the second dose, caused the previous doses preparation to be demolished? And so I think that if 21 days is there, then we should at least go for that much. Muhammad Minhaj says, why COVID patient lost their smell and taste sense when they infected? I didn't understand that mechanism. So Muhammad Minhaj, I actually did a very detailed discussion about it. What happens is that in the roof of the nose, there is the olfactory platform or olfactory bulb. In that bulb, there is olfactory nerve, and around that is epithelium. That epithelium or the supporting cells become infected and they become swollen, that press on the nerve, and that causes the nerve to not function correctly. That is one of the studies that we had discussed. There may be more mechanisms, but that is the study that came back with this data. Steve says, generally speaking, do we know if people who get infected with something they were vaccinated for, is the problem the person's own immune system messing it up or something else? So very good question. So there could be many possibilities, right? So the possibility are the following. Eventually, where we have to reach is that immune system is not able to handle the next time when the virus comes in. So how many ways that can be different? Number one, immune system was robust when we got the vaccine. It actually developed the response as well, or the training was done, but the immune system became weaker from the point A to point B, maybe because of some disease. That is one possibility. Second possibility is that, let's say, diabetes went out of control and the immune system didn't have enough energy and the efficacy to function similarly. Third way could be that the first time around, the immune system did not react that strongly and did not really create antibodies that are against the virus itself. So not effective antibodies, maybe. So when the virus actually came in, the antibodies were not strong enough, or the cell numbers were not strong enough. So that these are the immune system issues. And that doesn't mean a person's immune system is unhealthy. That simply means that some people with this dose did not respond sufficiently. Then this could be the virus itself as well. So let's say the person actually responded sufficiently. They are strong enough. But when the virus came in, the virus had varied. It had changed its epitopes. And so it could escape those antibodies and just cause infection again. So in my opinion, it is not that the viruses are escaping. It's just that the person did not develop enough strong response. So Art, Patron Forever, fluvoxamine has similar effects inhibiting serotonin as cyproheptadine, but fluvoxamine risk of adverse can. So the question, Art, Patron Forever, is that will cyproheptadine also work with the sigma 1? Because fluvoxamine's response is not just with the SSRI, it is the sigma 1 function as well. And I do not know about cyproheptadine to be doing that. Barbara Foreign says, Lotus poured the like and stole a piece of plastic. I had to catch her and she's super fast. That is so funny. So I guess that we can. So there's a question from William. I am interested in using fluvoxamine but getting an RX from online doctor. I've heard you want to be monitored by an MD, but I don't have that option. What side effects should I be watching for? So it is interesting. This morning I talked about it as well. And one of the cool beans actually responded and said, this may not happen. And he had used that word in the comment, and YouTube removed his comment and my response to that as well. So it looks like YouTube did not understand the context, but I understand why they removed it. So the William, it is really, the therapeutic window is narrow. So I know that you yourself are from healthcare as well. So what needs to be done is to make sure that your dosage is within that range, number one. And number two, any psychological, so for example, super depression, ideally it actually helps with the depression, but it can actually tilt people towards becoming more depressed or have suicidal thoughts. So just be aware of that. Tell someone that I'm taking this drug as well, so that they can monitor your general well-being, mental well-being. It doesn't do it. If it was that common for it to do this, then it would be off the shelves. But still, because that is one of the side effects, I don't want people to just take it off the over the counter and start taking it. Many countries who are listening to these, they can do it. So because of that, I'm very, very super cautious about this drug. So just be aware of this and have someone be aware. Arun says, what is fluvoxamine used for? Arun, fluvoxamine is used for some of the psychiatric needs, and it is a great drug. And one more thing, some of the cool beans were saying that, hey, fluvoxamine would work on a psychiatric need for in 2 weeks or so. Interestingly, they used fluvoxamine on the COVID patients and it started working immediately. So it may not be working through the same mechanism that helps with the psychiatric thought balances. It may have its own molecular effect, which are just different or in addition to the SSRI effect. And that is probably the sigma 1 pathway. And I'm talking in these cryptic words because we have already discussed this in detail with fluvoxamine. Jody says, hi, Dr. Bean and Cool Beans. I'm super late tonight. No worries. We are about to break. So Sepal Steve says, how are Qatar and France doing? Let's see. I saw France. Oh, sorry. France. So at least today the numbers are down, but generally they are going for another spike. Active cases are high, and the number of deaths are reducing or staying consistent. Qatar. What is the spelling for Qatar? QATAR. So still going up. Active cases are going up, and number of deaths are following that too. Although lesser number of deaths, but I'm sure that their population is small as well. Are they 5 or 6 million? Alexa, what is Qatar's population?
The population of Veneto is about 4,870,000.
Totally didn't get it. So Qatar population 2.83 millions. Yeah, so the population is low. Cool. So guys, thank you very much. Cool Beans, thank you very much. Please like, subscribe, and share. And if you would like to support this work, there are 3 links in the description. One is if you would like to buy me a coffee. Another one is if you would like to become a patron. And the third one is to support this work in general. Thank you very much. And for the UK, Europe, Asia, and Africa, I'll see you in the morning. For the rest of the Cool Beans, I would see you here tomorrow. I saw a question from William. I've seen in the trial they used 1,000 milligram thrice in fluvoxamine naive patients, whereas for depression, this correct. What are your thoughts? So I would go with the lower dose as well. So thank you once again very much. Thank you for being here. Thank you for your journey with me, and I would see you tomorrow. Bye bye.